Hello and welcome, Gold participants and listeners from around the world. I'm Kristen Schwartz, licensed midwife and MC for Gold Learning. And here at Gold, we are preparing for the upcoming Gold Lactation Online Conference of 2020. The conference will start on March 30th. And before we start the conference, we always like to check in with our speakers to get to know them a little bit, talk about the work they're doing out in the field, and of course about the presentation that they will have here with us at Gold. And with me today from Japan is Dr. Tomoko Seo. Welcome, Dr. Seo.
Thank you very much for inviting me to the conference.
It is wonderful to have you here today, and thank you for your time here to chat with me. It's so nice to. It's wonderful here at Gold that we can do this. We can be on opposite ends of the world and talk about the field of lactation that is, of course, so dear and near to our hearts, and we are so passionate about, right, Dr. Seo?
Thank you. Um, I'm very excited and a little bit nervous for presenting in English.
Your English is very good, and you will be absolutely fabulous, and it's gonna be a wonderful presentation. It's wonderful to have you here. So, Dr. Seo, tell us a little bit about yourself. You are a pediatrician and IBCLC in Japan, right? So, tell us a little bit about your professional journey and what you're working, how about your practice now.
Yes, and I'm graduated from my medical school in 1981 and became a pediatrician. And in the beginning, in the first training, I practiced general pediatrics. Then I worked in an ICU as a neonatologist for 1.5 years. And then I had my own children. So I retired from NICU and became a general pediatric practitioner again. And as I'm going to talk in the presentation, I was a very happy time with my children.
Mm.
And then I came back to clinic, my clinical practices, and I found many mothers struggling with breastfeeding. But I did not know anything about breastfeeding. So I wanted to know more about breastfeeding to help mothers.
Mm.
That's my motivation to learn breastfeeding. And at the
So,
same time, yes,
oh, I'm
at the
sorry.
same
Go ahead. Go
time,
ahead. Yeah.
at the same time, I knew the certification of IBCLC. So I became an IBCLC to increase my knowledge about breastfeeding. This is my short story.
Wonderful. Thank you so much for sharing that. So you, you were a pediatrician, then you became a mother yourself. And did
Yes.
you struggle with breastfeeding yourself in the beginning, or did it come easy to you? You said then after you became an IBCLC after you had your children, and I'm just curious, how your personal journey went.
Oh, yes. I did not have any trouble
Oh,
in
wonderful.
breastfeeding myself. So in the beginning, I did not understand why mothers are struggling with breastfeeding, but I don't know how to help them.
Yeah. So what you're saying is in your, as your education as a pediatrician in medical school, there was no information. You did not get taught, you did not learn about breastfeeding during your studies to become a pediatrician then.
So I did not have learned anything about breastfeeding.
Hmm.
Only tiny bit of the composition of breast milk. That's all.
That's all. And so would you say this is still the case in medical school nowadays, that physicians
Yes,
do not
yes,
learn
yes,
much?
yes.
Yes. Okay. That's very
Very, very,
interesting to
very,
know.
very few numbers teaches breastfeeding.
Interesting, interesting. That is very interesting. So tell me a little bit about the breastfeeding, if you know any of the breastfeeding rates, the initiation rates in Japan.
Oh.
How,
Yeah.
how is that?
And the initiation rate of breastfeeding in Japan is very high, more than 90%.
Oh,
And most mothers wants to breastfeed.
yes. And and how is it then? How are the rates remaining? Like for example, here in the US, where I am, I think the statistics are something like the initiation is like roughly 80%, start wants to breastfeed or does some kind of breastfeeding, and then by 6 months it's way down to less than 25%, if I'm not mistaken. So what are these rates in Japan?
And I don't remember the exact number, but more than 50% of mothers are still breastfeeding
Oh.
in um, 3 months.
Mm-hmm.
And however, exclusive breastfeeding rate is not very high.
Ah, uh-huh, uh-huh.
And many mothers are still breastfeeding after 1 year.
Right. I see. Well, thank you for sharing that. So, um, you mentioned you and IBCLC and you became certified, I think in 1999. Is that
Yes,
correct?
yes.
Um, in Japan, IBCLC, is that a profession that's well known, well respected? Is that, I know it's very, very well known here in the United States, but um, how is it in Japan?
Unfortunately, IBCLC certification is not known very well in Japan.
Ah, interesting, interesting. And so the work you're doing as a pediatrician, and you have this kind of, and you work with IBCLCs, you're an IBCLC yourself. This is then kind of a unique position that you have there, because you focus so much on breastfeeding in your clinic.
Yes, I have another pediatrician who is an IBCLC,
Hmm.
and as a pediatrician, I don't have enough time to counsel with the mothers. So there are three more IBCLCs who are midwives to
Oh,
help
wonderful,
me. And
wonderful.
we are in one team, and
Yes.
and mothers came to me not because of breastfeeding troubles, but some mothers came to me for vaccination or well baby check or sometimes an eczema or something else. And if the mother looks that they have some trouble with breastfeeding, I can refer them to my colleagues, IBCLC midwives.
Wonderful, wonderful. That's a nice combination, the nice setup that you have in your clinic there with midwives, IBCLCs, and pediatrician. That sounds lovely. It's well-rounded. It's a well-rounded clinic you have. So you mentioned so pediatricians in Japan don't learn much about breastfeeding or barely anything. There's not that many IBCLCs. So then it sounds to me like that many women who are breastfeeding, who have trouble breastfeeding, they don't get very much help then.
Um, it it depends on the situation, and in Japan, most of IBCLCs are midwives. And
Ah,
traditionally, midwives are taking care of mothers breastfeeding.
mm,
So most mothers visit breastfeeding clinic by midwives. But
I
some
see.
are IBCLCs and some are not IBCLCs. So the support is very different.
Hmm, that's interesting. Well, thank you for sharing that. It's always interesting for us to learn how, how it is in other countries, and I think that's so wonderful about Gold that we can all learn from each other and exchange knowledge and and see how things are working in other countries and other situations and cultures. So let's talk about your presentation. Your presentation is titled Lactation Education as advocacy, increasing knowledge among physicians. So tell us a little bit what you will be talking about and what you hope our delegates will take away from the presentation.
Yes, so I wanted to say just if the physicians are very knowledgeable and supportive for breastfeeding, it is very effective intervention to advocate breastfeeding.
Mhm. And
But some physicians do not have enough opportunity to learn about breastfeeding. So it is very important to provide them knowledge of breastfeeding.
mhm, absolutely. That sounds very interesting. So, and I know you're also teaching physicians about breastfeeding, right? So do you get a lot of feedback from physicians? Do they a lot of questions? Are they telling you, "Oh, I wish we would learn that. This is fascinating and so interesting, and I had no idea. I wish this we would learn this also in medical school."
Yes, not in the medical school.
Or,
We do have seminars for physicians about breastfeeding, and I belong to some medical societies and academies, and I am a member of a pediatric association on the listserv, so that I can provide them information about breastfeeding. And there
beautiful.
is a very active discussion among us pediatricians.
Wonderful. And you mentioned the association. What was the title? The um, Medicine for Breastfeeding. I'm sorry, I forgot. You mentioned earlier what was the organization you're involved in.
Uh, um, I am a member of Japanese Association of Lactation Consultants, and in Japan, more than 10% of IBCLCs are physicians,
Hmm.
and almost 85% are midwives. But we are colleagues, and we are working together to promote breastfeeding. And
And
I
I
also
just
belong to some other pediatric associations where I can promote breastfeeding. And
wonderful.
internationally, I am a member of the Academy of Breastfeeding Medicine.
Thank you. That's wonderful. And hearing also the collaboration of other healthcare providers such as midwives and nurses and IBCLCs and pediatrician, that sounds really like a wonderful collaboration then.
We also have OBGYN and other discipline in medicine, and
Hmm.
we can collaborate together.
Wonderful. Thank you so much, Dr. Tomoko Seo, for chatting with me here today. It was such a pleasure meeting you.
Thank you very much.
And for our listeners now, the presentation Lactation and Education as Advocacy, Increasing Knowledge Among Physicians by Dr. Tomoko Seo is part of the Gold Lactation Online Conference of 2020. This presentation will be live. Dr. Tomoko Seo will be presenting live on April 21st. And if you want to find out more about this presentation and all the other presentations in this conference, we have over 28 hours of accredited education this year. And also we have added elements, other interactive elements such as panels and workshops and Ask the Experts and case studies. So to find out more about all this, you can visit goldlactation.com to find out more. Thank you everyone for listening here with us today, and bye bye everyone, and I hope to see you at the conference. Bye bye everyone.